Welcome back. I'm Dr. Isabel Sharkar, a co-founder of Indigo Health Clinic in Washington, D.C., where we've been providing our community health solutions for complex chronic conditions for 15 years. Now, in our first mini training, we talked about the critical importance of putting you, the patient, back in the driver's seat of your health. We also explored why so many women feel stuck, unheard, and overwhelmed when it comes to chronic illness, and how the healthcare system often overlooks the factors that matter most. Today, we're going to address the elephant in the room by diving deeper into a key issue that keeps so many women like you from finding real answers: the misdiagnoses of chronic illness, and we'll also discuss what we can do to change it. So, why is misdiagnoses so common when it comes to chronic illness? Let's get straight to the point. No diagnoses means no effective treatment, and no treatment means no recovery. But here's the shocking truth. Around 5% of diagnoses in the United States are wrong. That's millions of people walking around with incorrect answers. And for complex chronic illnesses like chronic fatigue syndrome, Lyme disease, multiple sclerosis, mold toxicity and illness, the misdiagnoses rate is even higher, sometimes as much as 80% for conditions like chronic fatigue. Does this sound familiar? Because you've likely heard phrases like, your labs are normal, it's just stress, we don't see anything wrong, it's all in your head. Or you're getting slapped with all sorts of diagnoses like depression, anxiety, RA, fibromyalgia, MS, and prescribed all bunches of medications. And next thing you know, you're a walking pharmacy and still you feel crappy, or even worse because of side effects. The truth is, the problem isn't you. It's the system. Specialists often focus only on isolated symptoms like fatigue, pain, brain fog. No one connects the dots. So what is the elephant in the room? Have you ever heard the blind man and the elephant fable? In this story, each man touches a different part of the elephant: its tusk, its tail, its trunk, and describes something entirely different. I feel a wall, I feel a rope, or a tree, but no one sees the whole elephant. And this is exactly what happens in healthcare today. Each specialist looks at parts of your health in isolation, as if the body parts live in silo and not as an interconnected whole. And as a result, we're stuck in symptom-based treatments instead of solutions for the root cause. And the elephant remains unseen. So let's talk about why the elephant remains unseen so often. Let's take, for example, symptoms like fatigue, joint pain, brain fog, dizziness. These symptoms show up in conditions like MS, chronic fatigue syndrome, Lyme disease, Alzheimer's, and mold toxicity. But because they overlap, they often lead to different diagnoses depending on which specialist you see. And here's why it's also so easy to miss the big picture. Chronic fatigue is often labeled as depression or stress. Lyme disease is often mistaken for MS, fibromyalgia, chronic fatigue, anxiety, or depression. Mold toxicity is often overlooked or dismissed as autoimmune issues, anxiety, or depression. And early Alzheimer's, it's just dismissed as just getting older. Western medicine providers focus on symptoms in front of them, not the symptoms that connect them. This is why so many women like you feel stuck in a cycle of ineffective treatments and worsening health. You just might be missing a correct diagnosis. And remember, no diagnosis means no treatment and therefore no recovery. And if you've ever walked away from a doctor's appointment feeling like nothing was resolved, you're not alone. Chronic illness is complex. 15 minutes isn't enough time to understand what's really going on. Most PCPs aren't trained in functional or integrative medicine, which means they're not looking at hidden causes like Lyme disease, mold exposures, or toxins. And chronic conditions don't fit neatly into the boxes allowed by insurance billing. That leaves critical issues unaddressed. And even though misdiagnosis is common, it doesn't have to define your journey. So if you don't want to miss the elephant in the room, make sure to join the webinar. And if you can't wait another second before getting to the root cause of your health concerns, click the link below and schedule your clarity call now. I look forward to speaking with you soon.